Welcome everyone to today's webinar on health promoting cities. My name is Falk Müller-Riemenschneider. I'm an associate professor with the Socio-Oc School of Public Health, and I'm the moderator for today's webinar. I'm just going to share a few general information about the webinar and the structure of the webinar before we launch into the individual presentations. So first of all, this webinar is part of a series of talks. Some of you may have already attended some of these talks. It's organized by the Socio-Oc School of Public Health and funded by the Temasek Foundation. Previous topics in this series have been on precision public health and nutrition. Today's the third session, and there's a fourth session coming up in May, which will be on commercial determinants of health. So with regards to the topic of today's session, health promoting cities, obviously it's well known to everyone that there's an increasingly large proportion of individuals and people around the world live in highly urbanized environments and areas. This transition is particularly obvious here in Asia. And today's webinar is kind of an introduction to this topic and into this timely topic, and how cities and aspects, characteristics of cities and metropolitan areas can affect or can influence health and well-being of the population. It's also aligned with the principles of the Ottawa Charter on health promotion. So specifically, this webinar looks at the influence of social, natural, and built environments on health and well-being, with a focus on Singapore, but applicable to other countries and cities in the region and in the area. So I'm very excited. We have 4 excellent speakers for today's webinar. From different areas, urban planning and practice, but also academia, and they are going to share different perspectives and different topics that are relevant in the context of health promoting cities. So just to give you a bit of insight in terms of the structure of today's webinar, each of the 4 speakers will speak for about 15 minutes. Please post any questions that you may have in the Q&A panel that you find at the bottom of the screen, and we'll have a joint discussion of the questions at the end of our webinar. We should have sufficient time to discuss relevant questions. So please put in your questions throughout the presentations, and then we'll get back to them later on. Okay, that's it in terms of introduction. Don't want to take any more time from the speakers, so I'd like to invite our first speaker. Our first speaker is Ms. Elaine Tan. She is Deputy Director of the Center for Livable Cities at the Ministry of National Development. The center, Elaine, spearheads new research focused on the areas of building resilience, climate change, aging, and health and well-being in cities. And she's currently on a secondment. She has previously been, or her original position was with the Urban Redevelopment Authority, where she was Director for Strategic Research, and where she has been, where she has directed key research programs through Singapore's Land and Livability National Innovation Challenge. So without further ado, Elaine, I'll be happy for you to take over the screen and share your experience with us.
Right, thank you so much, Faulkner. I'm sharing my slides now. Let me know if things are okay over there.
Yes, we can see the slides.
Yes, okay, so I shall start now. Right, thank you so much. Thank you so much for inviting me here today to share. I'd just like to begin by sharing these 2 pictures of Singapore in the 50s and 60s and today. And just start by saying that the Singapore today, as we know, did not happen by chance. And the situation in the early years of our independence was characterized by overcrowded slums, like you see there, poor sanitation, and of course, pollution, disease, and even flooding. And all of this negatively impacted the health outcomes that we are here to discuss today. Yet today, we will be seeing Singapore being consistently ranked one of the most livable cities, even as our population has tripled since the 50s and 60s. Our life expectancy, for instance, has risen dramatically from a life expectancy of 64 years old in 1965 to 20 more years at 84 years old today. So all of Singapore now has access to modern sanitation, clean water, and electricity, which we all may sometimes take for granted. And Singapore has achieved this high livability despite its high density context. And over here at the CLC, we produce a matrix to plot the livability of cities according to the Mercer's 2018 Quality of Living Index against the city's population density. On your left, you can see that diagram. And interestingly, Singapore occupies a very sweet spot. One of the few countries in the top right quadrant with high livability and high density at the same time. Our research and study points us to the Singapore Livability Framework on the right, which distills the key principles from Singapore's development experience. All of this which lay the groundwork towards a healthier population. And the principles captured in this framework, we believe, are universal and they are definitely not unique to Singapore. And the principles captured in the framework are able to achieve its full effect because it requires an urban systems approach. And this is what we do to bring things together in Singapore across different agencies, departments, and ministry. And the outcomes of livability and health are met when the various urban systems are well integrated and addressed as a whole. So with this principle and approach in mind, it sets the stage for us to see that the livable and healthy city begins with an integrated master plan and thinking long term. So in Singapore, the concept plan, we begin with the concept plan, and this concept plan is the blueprint which sets out the strategic growth direction and land use needs in the long term. And this cascades down to the master plan, which is a more detailed plan that guides our land use and development in the medium term. And finally, to ensure that every piece of land is judiciously planned for in Singapore, the development plans help to detail these development parameters. So guided by these plans, I will next share with you the 6 planning strategies that we believe is required to develop a livable and healthy city. So the first one is decentralization and the creation of polycentric centers, which has been a key strategy in Singapore's developmental history, because this allows jobs and amenities to be located closer to housing neighborhoods and therefore reduce land development pressures in the city center. So in the early years of Singapore's independence, this helped Singapore to overcome the initial challenges of resettling occupants from slums into good quality housing with clean drinking water and proper sanitation, and this dramatically improved the public health of our population. And the second is the creation of self-sufficient towns amidst a high-density context. As most of you will know, today over 80% of Singapore's population is housed in HDB towns. And a key feature of our HDB towns is the neighborhood centers, which serve to bring the amenities within close reach of our residents. And just October last year, HDB unveiled a new Designing for Life roadmap that centers on planning and designing HDB towns that contribute to the overall health and well-being of its residents at all stages of their lives. So for instance, within neighborhoods, we have one-stop integrated community and lifestyle hubs, such as our Tampines Hub and Oasis terraces that bring together a comprehensive suite of facilities and services. So our Tampines Hub, for instance, is an enhanced transportation node served by 3 new MRT stations, thereby improving accessibility and convenience to encourage people to take public transport and therefore encourage more active mobility. And also by providing a variety of facilities and programs in this one-stop hubs like sports facilities, healthcare services, public spaces. They are also done in consultation with Tampines residents. And through the process of seeking their inputs, the project also fosters community ownership and deeper engagement with the residents and facilitate the sense of social well-being and neighborliness. A third strategy is consciously embedding health as a key aspect of our city planning. Enabled by the first and second strategy of polycentricity and self-sufficiency earlier, Singapore also plans for the adequate provision and distribution of our healthcare facilities by organizing the healthcare system into 3 integrated health clusters in the West, Central, and East. So each cluster provides a full range of healthcare services, all the way from primary care to general hospitals and community hospitals. And this is in parallel with how different regions are already planned to be self-sufficient for their residential, commercial, and recreational needs. So in this way, this allows residents to have holistic and quality healthcare within close proximity to their homes, and also help enable us to better meet our future healthcare needs brought about by aging population. But beyond healthcare, it is also about healthy living and a healthy lifestyle. So that's where city planning can shape an urban environment that encourages healthy behaviors and contributes to population health. And we all know that scientific evidence shows that the social and urban environments we live in contribute most significantly to population health and accounts for more than half the variation in population health outcomes. So this approach of planning for health as a key aspect was implanted in Singapore since independence 50 years ago, where plans and investments were made to deliver and ensure good, proper public hygiene and sanitation, access to clean water, food, air, and also the greening of our cities. And actually that takes me to the next point about greening and green spaces. Because in Singapore, we plan for green as well as blue spaces that are accessible to all. And if I could just quote our founding Prime Minister, Mr. Lee Kuan Yew, we need the greenery of nature to lift our spirits. And I think this is definitely very evident throughout the entire COVID-19 situation. Parks have been kept open throughout, even during the circuit breaker period. And with technologies such as the robot dogs deployed to assist efforts in enforcing social and safe distancing in the parks. So the accessibility of parks enable our residents to continue their healthy habits of physical activity in a safe manner, as well as the ability to let them get out there in order to maintain their physical and mental well-being. And in Singapore's high-rise and high-density context, we also demonstrated innovative ways of injecting greenery into pocket parks, vertical greeneries, and green roofs under the Landscape for Urban Spaces and High-Rise Program, or LUSH, L-U-S-H for short. And this is an incentive scheme since 2009, and we are now into the third version of it. And this allows people to also have access to green spaces even when they are living in high-rise buildings. So today, many of Singapore's parks feature very beautiful, naturalized waterways that serve both as water channels as well as recreation spaces. And these waterways are also clean enough for plants and wildlife to thrive and help to bring Singapore closer to our vision of becoming a city in nature. And our target is by 2030, 90% of all Singaporeans will live within 400 meters of a park. And in terms of public health, greening can definitely improve thermal comfort, air quality, and encourage walkability and physical activity. Furthermore, local and international research have also identified strong correlations of green spaces with mental well-being. And so, beyond planning of the built environment to improve livability and health, there's also been an overall shift towards involving the community to make direct improvements in their own local communities and neighborhoods. So an instance is an ongoing CLC project at Cambridge Road, and this project is a study on community resilience, social capital, and engagement through a participatory design process. And what that means is that through the process, the community themselves identify spaces in their neighborhoods where they could elevate heat stress, increase greenery, beautify their blank walls as canvases for art, and connect with their fellow neighbors to catalyze change in their neighborhoods. And these are all the process of the pictures that we have taken throughout the entire project. And this, if you can see, has fostered physical, social, and even mental well-being through the community-initiated efforts. And what is interesting is that this project started in 2019, but it persisted throughout 2020 by the residents out of their own will as they shifted from the face-to-face meetings to virtual Zoom platforms like this, webinars and workshops. And this was definitely a brilliant illustration of community resilience at work during the COVID-19 period. So the Cambridge project leads us to our next point: how Singapore recognizes technology as an enabler to support and enable the earlier strategies. So Singapore envisions itself as a smart nation where advancements in digital technologies are transforming the way we live, work, play. And this is evident in our recent adoptions and technological transitions during the COVID-19 period. Technology has played a very major role during the pandemic to help control crowds and contact trace in order to limit the spread of the virus. And we are now all very familiar with mobile apps such as Trace Together and Safe Entry. And to enable people to go about again on their regular activities and at the same time be able to make informed decisions with regards to safe distancing, initiatives such as URA Space Out and MPark Safe Distance at Parks will roll out and was supported by real-time visitorship data. So before I end, I'd just like to share that over the last 2 decades, the world has actually seen up to 5 pandemics. And the current COVID-19 situation is one of the biggest health crises of all time and has forced us to reconsider deeply held beliefs about good city form and urban planning. But if we believe every cloud has a silver lining, then cities should take this moment to harness innovation in urban planning and advance the healthy development of our cities, to relook at things, re-examine, and see what works and make it better. But this will also require not just a physical, but also a behavioral shift and mindset for everyone to come together, to cooperate, and work together to effect change for a greater good, so that we can continue to support a good quality of life and well-being, and to also build resilience in the face of other potential future disruptions. And before I end, I would like to also invite all of you to join us at the World City Summit in 2021, where the theme is Livable and Sustainable Cities, Adapting to a Disrupted World in June this year. We hope to continue this conversation with you, and we hope you can join us then. And with that, I thank you very much for your time. Thank you. I'll hand over back to you, Phong.
Yes, thank you very much, Elaine. Thank you for this really interesting, exciting talk and overview of how Singapore as a city has developed and evolved over time. It's really amazing to see how some of the things when myself and my family came to Singapore in 2012, we were amazed and leaving Changi Airport at the greenery and the amount of greenness everywhere around. It's fantastic to see now and understand how this has developed, and that it was not just chance, but very thorough planning and visioning behind all that. So thank you very much. So please to the audience, put your questions into the Q&A panel so that we can gather them, and at the end of the session, we'll have questions we can have questions for Elaine as well. Now moving on, I'd like to invite our second speaker for today's session, Associate Professor Jason Lee from the Yung Lin School of Medicine, National University of Singapore. Jason is an exercise and thermal physiologist. He's also a fellow of the American College of Sports Medicine and serves on various other international panels and responsibilities. He studies the physiological demands associated with passive and exertional heat stress and how humans adapt to ensure optimal performance. He also co-leads the research programs, for instance, the Human Potential Translational Research Program at the Yung Lin School of Medicine. And he also leads research programs on heat health and work productivity at the Global Asia Institute. He also holds many other responsibilities, but I can't go into all of them right now. So without further ado, Jason, thank you very much for joining us today, and I'm looking forward to listening to your talk.
Thank you, folks. All right, can everyone see my screen? I take it as a yes here.
Yes.
Thank you, folks, for that kind intro, and Elaine for that great overview of our local urban plan. And again, thanks for having me. And as folks say, I'm from the Human Potential Translational Research Group. We call it as HPTRP. So allow me to, in 10 seconds, sell what we undertake here. So in short, we basically maximize human potential and work productivity, all the way, from young to adulthood. And the key theme I've been given this afternoon is talk about in the changing environment. I love it, when I heard Elaine talk about thermal comfort and heat stress. So to this end, in relation to the changing environment, my talk will focus on how to impact on heat and its management as a key environmental stressor in our context. I think you agree that with new attention on this issue, partly created, or in fact, mainly created by the ongoing discussions on climate change. And I'll talk about optimizing our limited resources in humans, which in large part of the world has caused more hot days and hotter hot days each year. There are many ways here to show the world and Singapore getting warmer, and I found this slide to depict the frequency of exceptional days in the future compared with existing local maximums. So the average number of days on the bottom that will exceed mean maximum temperatures in the last few decades. It's not looking great, but don't worry, my message will not be a doom and gloom, but hopefully a message of hope, because there are existing and sustainable ways to beat the heat. Bear in mind, this magnitude of change prospectively is not just significant fiscally, but have huge, significant social economic implications. In recent years, you will agree that we are seeing more and more of such headlines. And I hope we don't get numbed to all these headlines because too much of a good or bad things, sometimes we don't pay much attention, but instead we should take actions as soon as possible. Feeling hot in our local environment is often perceived as normal. It's hot, humid, nothing new. But I think many are unaware on how detrimental heat can be to our overall health, well-being, and productivity. It's not all about getting exertional heat stroke here. But however, when heat is used creatively, it can also be a friend, not a foe. So I will talk a bit about that. I told you my message would be a message of hope. But first, you have to know between heat stress and heat strain. And they are not they are not the same. Heat stress is the effects of the environment on the person, on you, including the clothing worn, the work you are undertaking is in intensity and duration. So while climatic heat stress is important, it is not the sole contributor to the resultant heat loads incurred on you. Okay, that is more important than heat stress. So the important part is heat strain. Now, heat strain, on the other hand, describes how the person responds to heat stress. So you can say heat strain is the overall response to all the environmental stress that you are exposed to. Still unclear? Maybe. And I'll make it more concise. Now, heat strains, in short, is the resultant thermal load the body experiences predominantly from the weather, the work, and the clothing. And this is what we care more about. So why do we need to beat the heat? Well, the three key foundations of human health and well-being are diet, exercise, and sleep, right? And each of these, you may know, you might not know, can be hindered by the heat. For example, we all know you cannot last longer or play too hard under heat stress. You certainly cannot sleep well when you're hot, but maybe only a few are aware that you don't eat well in warm environment. So here's an interesting fact for those who are in Singapore. Remember that mee siam and fishball stalls that we used to dash to at the pools after the swim? We felt cold, remember? Many choose swimming as a modality to lose weight, but have not been the most promising. So I hope now you know why. Sometimes I half suspect whether the rise in obesity in Singapore we are seeing is at least partly due to the conversion of non-aircon to aircon kopitiams, enhancing our appetite. So as I say, heat is not a new enemy. In terms of heat management, I think the concrete documentation of the findings, it probably began from World War II. Then in recent years, you see how we talk about heat in the sport context. By the past decades, they have used heat as a friend, not foe. So recent experiments have actually shown significant positive cardiovascular and cardiometabolic health benefits from heat exposure across various populations. It can reduce inflammation, blood sugar, blood pressure, improves your circulation, at times soothes your aching muscles and joint. Also, heat in a unique way can be used as a friend too, so it's not all bad. So now we want to use these tools and knowledge to augment public health. So keep sharing across your disciplines because the solutions you need may well be found elsewhere. So I'm going to go through the next few slides on how these negative impacts on heat affect a wider society. So while the world gets warmer, I'm always thankful for our workers, our defenders, our firefighters, first responders, law enforcers who are still out there under warm environment. And these are usually the key outcomes we focus in occupational settings. And the several know-how in terms of heat management were actually first acquired from this context. But it's not just it on these workers. Go all the way to the other end of the spectrum, heat can also inhibit learning. So this is a good recent paper. I'll let you to read through, but bear in mind the temperature they used to perform the analysis was not classroom temperature, but based on regional climatic data. So we have commenced some work on heat and learning in adults and soon in children in Singapore and in Cambodia. And so if a similar association is found in our region, it will inspire more to be done in schools through various approaches, and not just by increasing the application of aircon, but various ways to enhance the classroom environment, or even manufacturing more thermally comfortable school uniforms. Sometimes I just kind of understand, in our context, why we're still imposing pinafores in school, why we're not allowing them to don PT kit attires, instead of on occasional days. But if only we prove that has an implication on their thermal comforts and therefore learning, then probably there will be motivation to do so. From the young to the aging society, we know the elderly and those with chronic disease are poor thermal regulators, and mainly because of their compromised skin blood flow and sweat production. And those are the two key avenues of heat loss. So, for example, in several work, they have found and described type 2 diabetics patients to suffer from impaired balance and greater loss in strength. And if heat potentially exacerbate these functional outcomes, we really ought to curb it to improve the quality of life in this population in our environment. And of course, we have this perennial problem of insufficient replacements in Singapore. Several epidemiological experiments over the past few years have shown these associations between high temperatures and adverse pregnancy outcomes, including preterm birth, stillbirth, low birth weights, etc. So through a recently commissioned project called Heat Safe, funded by NRF, we're in the midst of investigating whether these reported associations are also prevalent in our part of the world. And if so, it would be crucial to intervene on the effects of heat stress even during prenatal care. So taken as a whole, if I can sum it out, the effects on heat on work productivity and health are relatively well described in the occupational space. Similarly, climate exposure and impacts on health are also known in the public health space. But the keyword is but, the connections between these two domains of occupational health and public health at work and at home are poorly linked, and the knock-on effects across the domains are poorly understood, including suboptimal coordinated solutions across the sectors. So I presented this slide to show the problems we have at hand are often complex. So moving ahead, we need to collaborate even more. I call it the depth in breadth, not just going deep in your respective field, but go across. Okay, all the problems I've said, I hope it's not doom and gloom. I told you you'll be full of hope. So here are the solutions. These solutions, I like it because not only they are effective, they are also very sustainable. Buzzword these days, we hear from time to time. So I've shown this graph numerous times in my other presentations, but we know heat is a show stopper in our context. So over the past decades, there are effective ways that we use to beat the heat, and it's about modifying, adapting some of these known strategies to beat the heat. And also a good physiological heat mitigating, or you don't like it from a climate change language, just say heat reducing approach. It will reduce, attenuates, and/or extend your heat strain during exercise. Because by doing so, on the y-axis, we call it your heat capacity will be expanded. And this expansion of your y-axis, your thermal ability, will result in an enhanced work capacity, work quality, work tolerance, depending how you want to see it. Yeah, so I just go back again, this slide, a good physiological solution will either reduce, attenuate, or increase your heat strain during work, thereby expanding your ability to tolerate heat and extending your work output here. And we know these are proven way, and in this order, how you should harness a proven way, an array of techniques and solutions to beat the heat. And this slide informs how each of these strategies works in terms of expanding your limit here. So on the graph, the photo on the extreme left, and then next time you go out and do a hard run or a workout, keep smiling, because you're also heat proofing for the warming days to come. It's not just about health, but you are heat proofing simply by getting yourself aerobically fit. And finally, such reports on record high heat stress are no longer novel. The signs of global warming are dead clear. The ongoing pandemic has reminded us to be future ready and with great urgency. So let's take this as a full dress rehearsal for what is ahead. I hope my short talk has given some knowledge and motivation for you to partake with me in this mandate. If not for yourselves, then do it for your children and your children's children. And hence, I like this photo a lot. You heard earlier that I mentioned we have commenced a new project called Heat Safe. The eventual goals of that project is to map the complex heat, the threats of heat exposure to human health and work productivity in our environment, and we hope to identify sustainable and preventive policies to reduce the negative impacts. I really see that project beyond a project, but the capability to support and move our mandate in allowing us to not only survive, but thrive in the warming world. So please feel free to get in touch if you'd like to find out more about that project. And with that, thank you so much for your attention. Thank you.
Thank you very much, Jason, for this excellent talk and overview. It was very educational for me. It has not been a main area of my work, and coming from Germany, where it tends to be too cold, I was always very very happy about the heat in Singapore. But I do understand now, and I've learned quite a bit about heat stress and heat strain, and I hope I can differentiate the two in the future. Okay. So as I've mentioned before, please put your questions into the Q&A panel so that we can address the questions later on. And I'm sure there's going to be a few questions or a couple of questions for Jason as well. I'd now like to move on to our next speaker. You can already see the image here. Dr. Weijie Seo. She's a colleague of mine at the Sourcewell School of Public Health, an assistant professor at our school and at the Humboldt School of Medicine. She has gained her education background as from the National University of Singapore, but also from the Harvard School of Public Health. Her main research and teaching areas are related to the epidemiology of chronic diseases and molecular biomarkers, but she also does very interesting work in the context of environmental epidemiology and air pollution. And I'm really looking forward to hear Weijie's talk now and sharing her experience and her research examples with us. So without further ado, Weijie, please go ahead.
All right. Okay, can you see my slides?
Yes, we can see your slides, yes.
So hi everyone, thanks for the introduction. So today I'll be talking about air pollution and health in the city in Singapore and share with you some of my work on air pollution as well as personal air quality monitoring. So this is a photo that I took from my office on a clear, non-haze day with good air quality and low air pollutant levels. So you can see the mountains at the back and a lot of buildings. And this is another photo that I took from my office on a hazy day at the same time of day. So you notice that we can't really see the mountains and the clouds and some of the buildings so clearly anymore. So we all appreciate that air pollution is a major problem. We don't see it every day. So haze is just one extreme example, but actually the air contains particulate matter even if we don't see it. So every day we are kind of exposed to air pollution to a certain degree. So air pollution remains an important environmental exposure and public health problem in both developing as well as developed countries. There has been a lot of evidence over the years, I'm not going to go through them today, that has shown that air quality or air pollution is important to health, and air pollution has been associated with many diseases, increased mortality, cardiovascular diseases, hypertension, lung cancer, etc. And the International Agency for Research on Cancer, the IRAC, has grouped outdoor air pollution as a group 1 carcinogen. So meaning that there has enough evidence out there to show that air pollution is indeed associated or with increased cancers of many kinds. And according to WHO, around 7 million deaths worldwide could be attributed to air pollution as well. So this is just a photo of MBS on a really hazy day. So before I dive further into my studies, I just want to give a brief introduction of what PM2.5 is. So one of the key dominant air pollutant is actually PM2.5 or particulate matter, which refers to the particulates that are less than or equals to 2.5 micrometers in diameter. So over here. And since they are so small and light, these very fine particles tend to stay longer in the air than bigger particles or heavier particles. And this therefore increases the chances of us inhaling them into our bodies. And because they are so small, they can penetrate deep into our lungs, and some of them may even enter our bloodstream. So in order to reduce the adverse health effects of air pollution, it is important to identify its sources as well as to quantify it. So this figure is from another paper, is a systematic review, and it calculates the regional averages or sources of ambient particulate matter or PM2.5. And we can see here that the major sources of PM2.5 are color-coded. So a legend is over here. So if it's black, it denotes traffic, blue denotes industries, red denotes domestic fuel burning, and gray refers to natural sources. So we see here that overall, globally, 25% of urban ambient air pollution from PM2.5 is contributed by traffic, and then 15% by industrial emissions, and also 18% by natural dust and salt, and the other 22% is by unspecified sources of human origins. And in Singapore, the main sources of air pollution are emissions from industries as well as traffic, as well as the transboundary smoke haze from time to time. So this figure here shows the variation, the PM2.5 variation across Singapore on a somewhat hazy day. Actually, it was taken a few weeks ago this year, and we can see quite a bit of variation, mostly due to the different activities that goes on in different microenvironments that these measurements were taken. And this graph on the left here shows the reduction in air pollutants, including PM2.5 here, during the circuit breaker last year. And we can see that most of the air pollutants are largely reduced, mainly due to the reduced traffic as well as industrial activities. So the University of Chicago recently published a report on the Air Quality Life Index, and they found that particulate matter over here that exceeds the WHO guideline is accountable for an average loss in life expectancy of 1.8 years in an average person globally. And based on our calculation, I find it very striking that particulate matter actually causes more, a loss of life expectancy as compared to smoking, which is the second, alcohol, unsafe water, etc. And this table here is from the same report, and it shows the current PM2.5 levels in each country, the national standard that's used in each country, as well as the potential life years saved, if the country meets the national or the WHO guideline. It's a very busy slide, so I just want to point your attention to Singapore over here. So in Singapore, you can see that we still have some room for improvement in order to meet the national as well as the WHO guideline. So we recently published a paper on air quality, climatic factors, and COVID-19 case numbers. And as you can see from the table here, we actually found various air pollutants such as PM2.5, NO2, and PSI to be significantly and positively associated with COVID-19 case numbers. So for example, if you just look at PM2.5, like every 1 microgram per meter cube increase in PM2.5 was significantly associated with a 22.6% increase in the average daily number of COVID-19 cases. So we also reported in another paper that temperature is also associated with acute respiratory infections in Singapore. So in fact, this figure here shows the dose-response relationship, and we can see that the relative risk of ARI has a non-linear relationship with temperature. And we can see here that the relative risk of the RR here on the y-axis is higher at lower temperature as compared to higher temperatures. Yeah, so therefore anticipated extreme weather conditions or events that reduce ambient temperature can be used to inform, or increase healthcare resource allocation for ARI, for instance. So I've got to mention that PSI actually stands for Pollutant Standards Index. So it is an index of daily air quality levels, and it includes different concentrations of the several key pollutants, like I pointed out, PM2.5, PM10, SO2, NO2, ozone. So a previous study in Singapore actually found a positive association between PSI and all-cause mortality. So you can see here, boxed up here, that even moderate and unhealthy PSI, they're actually associated with an increased risk of mortality in Singapore. So over the years, most of the research done on PM2.5 relied mainly on air monitoring stations that are very few in numbers and mostly fixed in locations because they are so bulky and they're very expensive. So the use of personal real-time air quality monitors we feel may be more appropriate for assessing human exposures, and it has the potential for personalized prevention and immediate intervention. So we realized that there's a lack of studies using low-cost personal air quality sensors to validate these readings of the big bulky machines in the tropics in Singapore, for example. So to address this research gap, we previously published a paper on the association between personal PM2.5 in various microenvironments in Singapore and their association with cardiovascular health outcomes. So the primary objective of this research project was to see if first it was feasible or not to collect real-time personal measurements to PM2.5 using a low-cost, small, portable sensor in Singapore. And the idea is really just to use this sensor, go to different places, different microenvironments around the city at different times of the week and day, and we see how the air quality measurements vary over time across the different locations. And because the numbers are small, so we tried as an exploratory aim to also investigate the effect of air pollution on potential health outcomes as well. So my home is one microenvironment example that I myself and probably most of us spend a lot of time in every day, especially during the circuit breaker. So for the general population and ourselves, there are so many other microenvironments that we are exposed to every day. So here are just some common examples. This photo shows the different microenvironments that we sampled in this study, including homes, shopping malls, offices, hawker centers, restaurants, parks, public transport, etc. So these are the methods that we used. Basically, this is the portable sensor. You can see that it's very small, it's palm size. So they can be brought around as the volunteers move between the different microenvironments. The sensor actually can be paired to a smartphone, a phone app with GPS tracking. So the personal air pollutant levels are color-coded as shown here on the left. So these portable sensors measure not only PM2.5, but we also have data on temperature, humidity, and noise levels. And over here, you can see a screenshot of what the data looks like. So this is on a mobile app that links to the device, and you can visualize the variables over time, and it's mapped using GPS in the smartphone. So you can actually kind of pinpoint where each measurement was taken and the PM2.5 at each of the measurement, each of the location. So we also gave the participants or the volunteers a fitness tracker to measure their heart rate and also a portable blood pressure monitor. And we asked them to take measurements every half an hour. We also asked them to fill out a questionnaire and write a time activity log to keep track of where they went physically throughout the day. So we generally followed them for an entire 24-hour period. So we sampled a total of 18 different microenvironments, including homes, whether it's aircon, non-aircon, hawker centers, wet markets, food courts, or shopping malls, tertiary teaching spaces, hospitals, restaurants, etc. Yeah, so I'm not going to go through a whole list, so it's all here. So this shows some descriptive statistics for each of the microenvironment. And on the K column here, it's actually a total duration in seconds that we sampled. So it's the total number of data points we collected for each microenvironment, right? So as not unsurprisingly, we collected the most number of data points for homes because most of us spend most of the time at home, right? So here we highlight just the extremes, and we see that the distribution of the PM2.5 levels are quite varied. So generally, hawker centers have the worst air or the highest PM2.5 among these microenvironments. And also found that parks have the cleanest sort of outdoor air as compared to the other outdoor areas. And the indoor areas, the cleanest is the tertiary or offices or lecture theaters. Yeah, so these are just the mean PM2.5 in each of these microenvironments, as well as the standard deviation. But if we look within each of these microenvironments, we still see quite substantial variation. So not all hawker centers are made the same, and not all parks are the same. So we identified certain microenvironment hotspots in this study, such as hawker centers, that can increase one's personal PM2.5 exposures. And therefore, mitigations are needed at these hotspots to reduce PM2.5 in the general population. So we also did a site comparison of personal PM2.5 levels in major roads, minor roads, and park connectors. So this table at the bottom here shows the traffic count for each road type. So this was what we found here on the top. So again, not surprisingly, we found that PM2.5 levels were the lowest in the park connector, followed by minor and major roads. So transport is yet another major source of pollution, air pollution, and we expect that this will likely to be improved as we move towards electric vehicles. So lastly, we did an exploratory analysis on the association between PM2.5 and blood pressure, heart rate, and the associations are consistent with published literature. We actually found a statistically significant and positive association between PM2.5 and diastolic blood pressure as well as heart rate. And therefore, we found that short-term PM2.5 exposure in different microenvironments is potentially associated with immediate cardiovascular effects in individuals. So to follow on these findings, we're really excited. So we are currently carrying out a pilot study among hawkers in Singapore, and we are entering the final phase of our recruitment. So this is still a work in progress, and I'm not going to share any results today, but interestingly, our preliminary results actually show a significant difference in the air quality and cooking emissions across the different hawker types and cooking styles. So we hope to share our findings from this study in the near future. So cooking fumes is yet another major source of air pollution that we can potentially eliminate by having good ventilation. So speaking of ventilation, I just want to share this one example from Shenwei, which is a county in the northeast of Yunnan province in China, as shown here on the map. So this is an area whereby most people still use coal for cooking and heating. And the photo here at the bottom right shows, the typical kitchen. We see a woman frying some vegetables for her family's dinner using a fire pit on the floor without any ventilation at all. So we actually did an intervention study many years ago, and we actually compared the lung cancer risk as well as air pollutant levels before and after installing chimney in homes. And we found that stove improvement or better ventilation at home by installing chimneys was associated with a reduction in lung cancer risk. In fact, almost a reduction by half. We observe in both men and women. So this is just another extreme example, but any improvement in the kitchen ventilation will be beneficial. All right, so I guess this brings me to the end. I'd like to thank all my colleagues and collaborators and all the different funding sources. And before I end this presentation, I just want to put in a quick pitch for the latest study that we're running right now, which is an online survey about the knowledge, attitudes, and perception of air quality. So if you are between 31 and 40 years old or above 60 years old, we need you. We would really appreciate it if you can take some time to complete this survey for us. So I thank you for your attention, and I'm happy to answer any questions later on during the Q&A session. Thank you.
Thank you very much, Wei Jie. Very interesting talk, and thanks also for pitching for your research. I realized I'm not eligible, so I can't participate. But everybody else who is, please sign up for the study if you're interested. I'm very excited about all the sensors you're using. You know that we do similar work, but not with a focus on air pollution. So I'm sure there's a lot of interesting points one can discuss. All right, so please put your questions into the Q&A session for Wei Jie so that we have questions later on for her as well, and then we can address them in our shared discussion session. I'd now like to move on to our last speaker of today's session, Dr. Nicolas Petranov. Nick is a research fellow at the Salisbury School of Public Health. We're working actually very closely together, and he leads most of our school's work, at least for our work, on addressing aspects of the built environment in relation to health, green spaces, mobility, and health. Nick has got his PhD from the University of Sydney, and he has expertise in qualitative and quantitative research, and particularly with a focus on policy implementation or informing policies, which also reflects to some extent his background, where he worked in governmental agencies and in Australia. Just on a side note, Nick is also very passionate about promoting physical activities and is a coach for young soccer players in sports clubs in Singapore. All right, okay, so without any further ado, Nick, happy for you to take over the screen and share your presentation with us.
Okay, thank you for the introduction, Falk, and I'll just share screen, and hopefully you can see this, and I'll just bring the presentation up.
You can see your screen, yeah.
Yep. Okay, so good afternoon, everyone, and again, thanks for the opportunity to present here today. My talk is on designing active and sustainable cities. And I'll begin by demonstrating how we've designed inactive and unsustainable cities in the past and summarize policy which aims to reverse this. We'll then focus on two actions that are relevant to making cities active and sustainable globally: bringing back nature and making them car light. Bringing back nature will be the focus, and I've got a few slides on making cities car light to finish. I like this photo here. It's from Lornie Road. There's these two photos actually adjoining the McGritchie Reservoir, and recently during the redevelopment of the highway on Lornie Highway, they reallocated land on Lornie Road here on the left, this lane here, to become walking and cycling path with a nice verge. So that makes that valuable parkland more accessible via foot and bicycle. So this quote here, when I read it, I saw this question as a challenge, and it made me think. The quote goes, "We are the first generation in human history in which the mass of the population has to deliberately exercise to be healthy. How can society's collective adaptations match?" And the quote was from the late Professor Jeremy Morris, who is credited with starting the field of physical activity epidemiology in the 50s when he conducted the London Busman studies, which were the first prospective epidemiological studies to establish that physical inactivity was associated with coronary heart disease endpoints. And I'm not going to cover physical activity and non-communicable diseases today, since that link is already very well established. As we move on to the next slide, which illustrates some temporal trends in physical activity globally, please keep Prof. Morris's question there in mind, because I'm going to try to answer it with this study. So this study used time use and physical activity surveys to describe the global declines in physical activity which have occurred over the past half century and modeled the future in 5 countries: the US, China, Brazil, India, and the UK. So that at the time of the study represented about half the population of the globe. It's not important to understand all the detail on this slide. The main point I want to make is that in all countries and in all domains where physical activity occurs, there's been declines in energy expenditure from physical activity in our waking hours, whilst there have been increases in average hours per week being sedentary, shown by the solid black line. Now, if we think about each of these domains represented under the trend lines here in the figure, it's not hard to understand why. So the bottom one there, representing the largest proportion of the figure, is occupational activity. And in China, and although it's not shown here on the slide, in Brazil as well, there were very steep declines in occupational physical activity, which were largely due to shifts from the societies being largely agricultural through to becoming more manufacturing-based and moving into tertiary and service sectors for employment. As well as when countries become wealthier, mechanization of occupations tends to occur. So there's been very large declines there in occupational activity. Just go back to that slide. And in domestic settings, in developing countries, as countries became wealthier, we had electrification and piped water, and globally, consistent across the globe, it was the century of the car. So that travel is inactive, and as countries became wealthier, people drove more and there was less travel-related activity. And as we all know, the black line up the top, our sedentary behaviour, now that digital ways of working and playing have pervaded every aspect of our lives. It's no surprise around 2007 there, with the widespread introduction of smartphones, our screen time or sedentary time increased, and that is a global trend as well. So realistically, we'll not want to wind back the clock here and make our occupations and household tasks more labour intensive. So we'll need to increase physical activity from transport and leisure if we want the population to achieve adequate physical activity for their health. So if we think back to Prof. Morris's quote on the previous slide, I think it's half right. Leisure physical activity is generally deliberately planned, so he's right there. However, travel-related activity can be built into our everyday life, and we don't have to deliberately plan that as exercise. So our walk to and from the MRT, for instance, before and after work is just something that we do every day. I think the projections could also be pessimistic, since as we move towards the greatest challenge of our time, which is addressing climate change, there is a global imperative to design physical activity back into our lives by creating active and sustainable cities. And on the next couple of slides, I'll present some policy documents that provide a roadmap for this. So there are 17 sustainable development goals created by the UN, which provide the high-level roadmap for a sustainable future on our planet. And goal 11 is the most relevant to this presentation: sustainable cities and communities. This goal is very important to consider in Asia, since 90% of growth in urban areas is expected to happen in Asia and Africa in the next 30 years. We already know over half the population of the globe live in urban areas, and that is projected to increase to 70% by 2030. under this goal, there are two globally relevant actions where there are clear co-benefits for physical activity and sustainable development. Improving access to public spaces, including green spaces like parks, and making our cities car-light by improving public transport and making them more walkable and bikeable. These actions can both contribute to decreasing carbon emissions in our cities whilst increasing physical activity. So there are clear co-benefits. So the UN Sustainable Development Goals provide the high-level roadmap for sustainable cities globally. But on this side, we'll look at two action plans to help achieve those goals. In November last year, the peak body for physical activity promotion globally released a supporting document to the WHO's Global Action Plan for Physical Activity 2030, which contains 8 investments that work for promoting physical activity. These have also been mapped against the UN Sustainable Development Goals, and you can find more about that at that link there at the bottom of the page. Today, I'm going to focus on 2 since they're highly relevant to cities: active urban design and active mobility. So the next policy document, which is more of an action plan, was released in February this year. So it's almost hot off the press. It's Singapore's Green Plan for 2030, or the Green Plan. And it contains 5 pillars which strengthen Singapore's commitments under the UN's 2030 Sustainable Development Goals. And the first and the third pillar, city in nature and sustainable living, align very well with these action areas of active urban design and active mobility. So that brings me to the next section of the presentation on active urban design. So one aspect of active urban design is cities in nature, which I'm going to cover here today. There are other important aspects like the compact cities concept, and you can look into that. There's plenty of good literature out there on that. So this is the first pillar in Singapore's Green Plan, and these actions represent a major intensification of greenery, substantial increases to accessibility of public parks, as well as preservation and enhancement of natural environments. I just want to highlight one action, or even half of one action. So I'll just point to it here. So that action is to have every household within a 10-minute walk from a park by 2030. And Falk and I have been conducting some research here at the school on access to parks. And as part of that research, one of the things we did is we mapped the whole of Singapore geospatially for elements of the environment important to physical activity, but we mapped, as part of that exercise, we mapped all of the National Parks Board's parks in relation to people's homes. So, and we measured the distance to the parks from 3,500 people's homes via the walkable street network. So this is an objective assessment of access to parks. And what we found was that currently 30% of households have a park within 800 metres, which is about a 10-minute walk via the walkable street network in Singapore. So this action, if it is achieved and realised, which I have no doubt it will be in Singapore, will substantially increase the number of parks within 10 minutes walking distance, providing lots of attractive places to be active outdoors. So this supports increases in leisure time physical activity. Now going to move on to another piece of research here at the school called Parks and Health, which is a 4-year collaborative project funded by the Ministry of National Development and the National Parks Board in Singapore. It's now nearing completion. Intersectoral collaboration is important in the urban design space, and this project is a nice example of that. During this project, Falk and I have had the pleasure of collaborating really closely with the National Parks Board, but also working with Sport SG and urban planners within both organisations, as well as urban planners in academic settings. So the objective of the first study for parks and health was to investigate associations of park use and physical activity in parks with well-being. I'm just going to present the main result now. So we used survey data for this study, and there was 3,500 participants from the school's multi-ethnic cohort. So in this table, we see results from regression models which test the associations of park use and physical activity in parks with an overall well-being score, which was out of 100. So we broke park use and physical activity times into quartiles that you can see there in the table to examine patterns in these associations. And what we see here is a very clear and consistent pattern where with each increase in park use time and physical activity time per month, there's a greater increase in the self-reported well-being score. We can also see that those associations, if we focus on the bottom half of the table, I don't know why that jumped back. So we can, if we focus on the bottom half of the table here, we can also see that those associations are particularly strong between physical activity in parks and overall well-being scores. So what we can see is that compared to, compared to participants who do almost no physical activity in parks, those with the highest level of activity in parks of over 8 hours per month achieved about a 4-point higher well-being score out of 100. So that was statistically significant for all the differences between all those levels and the reference value. But a change in a score out of 100, which is approaching 5, is also about a statistically meaningful change. So the implication here is that park use, and particularly being physically active in parks, may have benefits for mental well-being of city residents. So on this slide, I'm just going to touch on a study which Falk and I conducted on the effects of prescribing physical activity in parks. So this was a sort of an intervention where brief advice was given by health professionals to participate in physical activity in parks, and there was some support along the way. Just to touch on the effectiveness, we found that in the RCT, we found that the intervention achieves large and statistically significant increases in park use, physical activity in parks, and recreational physical activity in the intervention group. And they were also statistically greater than the control group who only received a brochure. They also had better psychological quality of life scores. However, whilst the intervention group did achieve greater objectively measured physical activity, this result just missed out on being statistically significant. We also conducted a process evaluation of the park prescription intervention, and it was a mixed method study. And the main finding on mechanisms of impact for the park prescription was that physical activity in parks was a strong mediator of all of the intervention effects. So physical activity in parks was particularly important in achieving greater quality of life and the other significantly greater scores. So just to finish up on the last section here on active mobility. Active mobility is travel that involves physical activity, and it includes walking and cycling alone or in combination with public transport use. It's important since it can be built into everyday activities like going to the shops, work or school. So in Singapore, in a nationally representative study conducted by our Panda group, we found that amongst adults in Singapore, transport represented 50% of all physical activity. So it's an important form of activity. And it's probably not surprising since the travel mode share for public transport in Singapore is 63%. And that's because there's a cheap and accessible public transport system, but it's also because of strong policies to restrict car ownership. And whilst that's a good figure, the 63% there, public transport use, unfortunately, the cycling mode share is very low in Singapore at less than 1%, according to this report here from the Centre for Livable Cities. Just to finish off on a really positive note, this is one of the relevant actions in Singapore's Green Plan. And I'll just pick up on the middle action there, and that is to triple the cycling path network to 1,320 kilometres by 2030 from 460 kilometres currently. So just a little anecdote, when I arrived here in Singapore and I found this spaghetti map here, I used to put this in a slide for teaching, and it used to be, the plan was to create 700 kilometres of this walking and cycling network here. So thanks to this green plan, it's almost doubled in the 5 years that I've been here. And that should make it realistic for people to travel to most places in Singapore by foot or by bike if they choose to. So just to sum up, to design active and sustainable cities, we need intersectoral approaches, policies in place, but systematic approaches are required to implement the actions. And we've seen considerable efforts are being made to create an active and sustainable Singapore. So in that respect, I guess Singapore is has some great examples to share with other countries in Asia. And we now need to further strengthen systematic approaches to understanding physical activity and sedentary behaviour, and developing and rigorously evaluating strategies to create active and sustainable cities. And I did have a thank you slide, but I might hand back to Falk and I'll just put up some acknowledgements. Not there. Anyway, over to you, Falk.
Okay. Thank you very much, Nick, for this very nice overview and very interesting findings from some of our work in Singapore. Yeah, thanks very much, all the speakers, for your excellent time management. It gives us some time to address some questions. So if there's any questions from the audience, please put them in the Q&A chat or in the Q&A, and we can try to address these questions, or the speakers can try to address these questions for you. There were already a few questions. I'll just give you a bit of time. There were already a few questions on recording of today's session, and yes, it is being recorded and it will be available on the webpage of the Salisbury School of Public Health. So anybody who wants to have access to this recording afterwards can get access to it then. Okay, so I'll look at the Q&A. There's a question here. Considering when it was posted and the content, I think it's for Elaine, the first one. The question is, how do we balance a health-enhancing environment with public perceptions? And there's also an example given here. So for instance, naturalized drainage is more efficient, but public may not perceive them, may not perceive them as well. Elaine, can you comment on this question?
Yeah, okay. So I was looking at the question and I was thinking about health enabling environments, but public perception. They talk about drain, so I was trying to reconcile this. But I suppose, I think generally, if you're talking about health enabling environments, we're saying that there are certain things that we would do in terms of, for instance, if we talk about drains, I'll just start with the drains there and the naturalized canalways. I think there is a need first for education, I think clearly. So for instance, at the ABC projects, I mean, the Active, Beautiful, Clean Waterways that we see that is done by PUB across Singapore and all the green and blue spaces. It's a wonderful space to bring in greenery, for people to feel a sense of better social and mental well-being, because there is, after all, a certain multi-sensorial delight in hearing water seeing the water flow, the green that is flowing. So when there are times when there is like heavy rainfall and the waterways are being flooded, for instance, I think that was the question. People should be educated to deem that that is part of the way the drain is supposed to work, to act as a sponge, to drain the water away from the park. So actually, I don't quite understand the question about maybe how do you understand the question, Falk?
I think I understood the way that we can also ask the person to put up the question to clarify it, obviously.
Yeah.
But I understood it to differentiate or to balance between this perception and the health promoting aspects of certain strategies, and whether this is possible or whether there may be kind of differences between the two. But why don't we, I mean, I think you have addressed part of it, at least as far as I understand it. Why don't we see whether there is a clarification to the question and we can revisit it later on. Okay?
Yep, I think so.
Yeah, okay. Right. I think we also had a question for Jason here. It's something to do with climate. So I suspect it's for Jason. Interesting one. And the question is whether colder climates in the northern hemisphere maybe, or the proportion of them maybe have a higher prevalence of being developed due to their colder climate, due to the colder temperature, and therefore better productivity or positive effects on the population. Interesting one. Jason, can you comment on that one?
Yep, I can. Thank you. In brief and in general, yes to the question. So especially you talk about activity that requires you to exert. And I think the closest example I could give you is, you ever try to run a race or do some activity in a cool versus in a hot environment, you will feel that you will either go longer or you will complete the distance faster. And so that's a reflection of your productivity. If that is the context that the question is from, I mean, there are all kinds of productivity, right? But I like to interpret this question. And if you do an experiment to build a 10-story building in Singapore versus in the cooler parts of the world, you'll find that the latter will be completed much faster. So that's another example of productivity.
Thank you very much. I mean, the example of the exercise is definitely something I can relate to. When I came to Singapore, I was shocked how performance dropped on certain exercises that I used to perform prior to coming to Singapore.
Yeah, so
thank you very much.
Too hard on yourself. You can never do a personal best in Singapore in all kinds of endurance race. So pay a little bit more, go back to Germany, and you'll do much better.
Right. Yeah. Thanks. So that's some sport advice here for everyone. Okay. Thank you very much. The next question we have here, I think that's something that is Nick. It's probably something that comes close to your heart and work. Relationship with, or not relationship, but harnessing support from governmental agencies, and especially those who are not health-related governmental agencies. So in the context of health promoting or health promoting cities, how can we are there any strategies or any advice how we can harness non-health governmental agency support for such activities?
Thanks, Paul, and thanks for the question there. That's a really important point. I mean, it's well understood, definitely from a public health perspective, and in our contribution to making cities more active and sustainable, or just more livable generally, that we need to work intersectorally. So in terms of how we can harness support, I think really at a high level it takes leadership and an understanding that certain issues are whole of government issues. So for instance, when we saw the Green Plan earlier, and I put up the initial slide on the cover of the Green Plan, the organisations involved were Ministry of Education, the Ministry of National Development, Ministry of Sustainability and the Environment, and Ministry of trade and industry and transport. So all the key players on key environmental issues need to come together. That's a governmental thing. Then non-government is very important as well. And Elaine in her slide shared that one of their key areas was community involvement. And this is very important that you know, community feeds into all of these processes so that with these higher level issues, we're not missing the day-to-day key things that matter to individuals and really make cities livable. So mechanisms for community involvement relate to governance. So if we set up governance structures that when projects commence that involve the community, that's one strategy.
Okay.
Elaine
Thank you
might
very
want
much.
to
Yeah, maybe I could
Yeah.
also add on this question. I understand. So maybe just to add, I think from even like Nick mentioned, even from the way we I don't think we need to say that we are a health or non-health government agency, because I think from every aspect and wherever we are in government, we should take it upon ourselves to look at the issue from a health angle. Because as I mentioned earlier, the only way to achieve something greater than what you can do yourself is actually to take a more systems approach to things and see how everything is interlinked together. So if all of us, I think this COVID situation has demonstrated that as well, where we see that in a very, very short period of time, the agencies had to come together, work together, collaborate to make things work. And so it doesn't matter which agency you are from. So even if you are, say, from the infra agency, like whether you are from MND or BCA, HTB, we very quickly look into where are the spaces that we could use very quickly for quarantine facilities, for instance. And if you are in the Singapore Food Agency, for instance, where you're coming from will quickly be to see how do you ensure the continuous supply of essentials like food, and also that food continues to get delivered to household. So how can we better harness support and commitment? I think there is a good demonstration there, though I won't say it was perfect, but I think we managed to get through the hardest point then.
Okay, thank you very much. I actually got a personal, two personal questions for Wei Jie, which I really like to learn more about. The first one is more from a research methodological perspective, in terms of using all these devices you have used in terms of compliance. How feasible is it to apply them to a somewhat larger population? Because you've highlighted that it was the sample was relatively small. Could we apply them to a larger population and thereby get more generalizable information on the issues you have been exploring and investigating? And my second question is related to the hawker centers, which you identified as having particularly high levels of fine particulate matter. I know it seems like you're planning to look into this in more detail, but I may have missed it, but what is your current hypothesis why the levels are so high? Is it something related to the cooking, or is it something related to the location where they are located in Singapore?
Yeah, thanks for the question, Falk. So for your first question, I think definitely there's potential to roll it out to bigger populations cohort. Like I mentioned earlier, it's a low cost and portable sensor. I think the only thing is that, most of the cohorts are already quite overwhelmed with sensors and questionnaires. So I think that's the only limiting factor, because they really do have to put some work into it. As I mentioned, they have to charge it because it runs on battery, obviously, and they have to take care of it to make sure that they don't, like throw it around or drench it in water, because it's actually not waterproof. Yeah, so you still have to care for the device a little bit. So I think it requires some sort of effort from the participants as well. But I think there is definitely potential to roll it out to the general public, maybe not part of a cohort, maybe like a separate study, but to include more people so the results can be more generalizable. And your second question is about hawker centers. So I think, like I mentioned earlier, we are still working on the pilot project, but we do see a significant difference across different hawker types and cooking styles. So I suspect that probably the higher PM2.5 is probably due to the the nature of the hawkers, the fumes that they generate, not so much about the location of the hawker center. But we'll look into that a bit more.
Yeah, that would be interesting. Thank you very much. Yeah. There's a few more questions here. I think we've got a few more minutes. So there's one, there seems to be an interest in the elderly population, given the rapid increase in the elderly population in Singapore, but also in general. One of them relates to heat stress, so I'll pose that one to Jason. So the concern is that elderly are particularly vulnerable to heat stress. And then the question is, what are the strategies to help mitigate the impact of global warming on this group of Singaporeans? And after perhaps Jason can address this question, there's two more questions for Elaine potentially.
Yeah, thanks, Falk. As I mentioned, what we know right now, if you are old, you have impaired thermoregulatory responses, very specifically an increase in skin blood flow and the ability to sweat. But what we are unsure is whether this is age per se or the age-related aerobic fitness that gets degraded over time. So potentially it's not about you getting old if we can keep fit, and it's in line with our general theme here, right? To keep on moving, participate in physical activity. That might be a good, practical and sustainable way to mitigate this age-related physiology. What we also don't know, not even for the elderly, for those who are on medication, we are aware that some medication compromise your heat loss too. So it's about quantifying what are the limitations. Then once we know the problems, often the solutions are not that difficult. For example, we shouldn't loosely ask our type 2 diabetics patient to go out and exercise, saying that it's good to exercise outdoor, not knowing that they really struggle with heat stress. And therefore, maybe in that population, either we perform some cooling strategy, cool them down so that they can last longer, or we say probably you are the population that deserve to be in the aircon environment to fulfill that physical activity needs. And also there's strategies I briefly ran through, maybe aerobic conditioning, heat acclimatization, a specific work rest cycle or exercise rest cycle, cooling, hydration. If you can tailor those strategies, known strategies that have prepared personnel in the harshest environment, the soldiers fighting wars, for example, really, I think we can adapt those, for this high-risk population. So fear not, it's about talking and sharing, with each other. There are individuals, who cannot thermoregulate at all. There are people who are disabled competing in high-level sports where they produce high amount of heat. And those work has been done over the past decades. Is about learning from those populations and apply it in this compromised population, and we should be fine.
Okay, thank you very much. Yeah. Okay, so we are approaching the end of our webinar. I'm going to ask two last questions, one for Elaine and then for related to the elderly as well, and then perhaps one question that is here on mental health for Nick, because he's been looking into that to some extent. The question for Elaine, now I lost the question here right now, is related to the plans of rebuilding our estates to be more elderly friendly in terms of integrating with the younger generation, but also considering retirement homes. Elaine, can you comment on that question?
Sure. I think we have to look at it from different angles about what it means to be elder friendly and whether it is about an existing mature estate or a new estate. So in terms of mature estates right now, there are programs to bring the younger generation in, young families through, for instance, the SIRS program, and at the same time retrofitting the existing mature neighborhood to be more elder friendly while bringing in the young families in and with new program and regeneration. But at the same time, I mentioned earlier about a HDB announcement in October last year about designing for life and how do you design for different stages of life throughout the entire life cycle of a person as well as for that community. So that means looking at spaces, building flexibility to adapt and to change users according to the needs of the residents as well. And that will allow people of different stages in their life to live together within a community. But I think end of the day, we also should understand that we should have different strokes for different folks, and not everybody is alike. Especially as you grow older, you will be more keen or inclined to a certain way of living and what kind of lifestyle choices you want. And with our educated population, a more and more educated population, there will be more options that we have to offer to them. And for instance, there are people who, when they grow old, will prefer to continue to live with the extended family. And so for that, we have what we call the multi-generation homes, which are bigger flats where 3 generations or even up to 4 generations can live together under one roof. But there are also those that we know that who want to continue to age within their own estate, so they can continue to live within their neighborhoods and their communities, and they will be taken care of by upgrading programs and service programs to bring new life into the area. And of course, recently we have seen a shift towards elderly who want to be more independent and live independently, which on their own, as a couple or alone. And so we start to see projects like the Kampung Admiralty, which I have not mentioned, but many of you will be familiar with, which are homes where, like studio apartments where the seniors can live in, but they are still connected because there are facilities around them and they're still plugged into their neighborhoods. And even more so, in time to come, we'll be able to see what we call the assisted living or community living. And there are going to be pilots in Bukit Batok coming up very soon. And that will be another option where our seniors can live in the midst of their community and where there will continue to be regeneration and rejuvenation. Thank you.
Well, thank you very much. It seems there is already quite comprehensive plans in place, and thank you also for mapping them out for us. This is really exciting to hear. Okay, so final question for today's webinar. I'm sorry to everyone for all the questions we cannot address anymore today for the sake of time, but final question for Nick. It's a question about efforts to improving mental health in future or in more urbanized societies. Can you comment on that question, Nick?
I know. Well, I guess I'd have to say up front that mental health is not the focus of my research or teaching, but I'm very interested in well-being globally and its relationship with physical activity and urban environments specifically. So I can just provide a couple of examples. But first, I'd just say that in a primary prevention sense, physical activity, and even secondary prevention actually, physical activity is associated with reduced stress and mental well-being overall. That's very well established. Apart from that, looking at relationship of urban environments, for example, 2 examples I can provide. When we've been doing this work on parks and health, we use that comprehensive well-being measure, the Stanford Well for Life tool. It contains 9 subdomains of well-being, including of mental well-being, including things like psychological stress and resilience, social connectedness, very important for mental well-being. So we looked at all of these aspects of global well-being overall and their relationships with park use, and seems that in our population of 3,500 that we looked at, that being active and also being active in parks is important to all of those subdomains of well-being. And the more active you are in parks, or the more exposure you have to parks, that there's this sort of dose response of park use and mental well-being, which was interesting because that hasn't been studied globally, or not that we're aware of anyway. Another example is work with the elderly in Singapore. I know that colleagues in the school who do focus on mental health always are working towards measures that measure bio, psycho, and social health. So psychological health includes considerations around mental well-being. And there's some good research in our school with the elderly that has looked into those issues. There's not enough time to go through all that here today, though.
Yeah. Well, thank you very much. Thank you very much for addressing this and highlighting this evidence that is available. Okay, so we have reached the end of our webinar. thank you very much again to our 4 speakers. It was really very interesting, exciting. I hope the audience had the opportunity to learn something. As I've mentioned, the webinar will be available, the recording, on our school's homepage. So there's a chance to revisit certain aspects that our speakers have addressed. Moving forward, as I've mentioned at the beginning, there's one more webinar in this series, going to be in May, on commercial determinants of health. So I invite everybody to join this webinar, which will conclude this series of webinars, at least for the time being. So once again, thank you very much to all our speakers, and thank you very much for your attendance, for joining this webinar.